Hello guys, you're welcome to my channel, and today we'll be talking about the reasons why patients fall out with their physicians and what patients and their family need to know. And this is in the context of patients with fibromyalgia. Fibromyalgia is a very difficult condition to manage. It is difficult particularly for the patient and their family, and dealing with this condition can take a lot from them. Now, it can be further compounded with not having good and smooth relationship with their caregivers and particularly their physicians. How we can understand how things like this come to happen and how to avoid them are among the things we're going to discuss today. And we'll jump right in. If you find this channel helpful and these discussions particularly beneficial for you, please do not hesitate to like my channel and subscribe, and let's get into it right away. The first set of factors we're going to talk about are the patient-specific factors that could lead to the risk of falling out with your physicians. Number one is the perception of disbelief. All too often, patients bring their concerns to the doctor. A patient with fibromyalgia tends to have a lot on their mind. The disease manifests in so many ways that are potentially overwhelming for the patient. And sometimes when they are talking to the physician, who probably wears a blank face and doesn't offer a lot to help at the end of the discussion, the patient is particularly worried that they do not believe them. This is a very common scenario and can lead to the falling out of patients with doctors. Another factor is the feeling of being referred around. All too often it feels like when the doctor cannot help a patient, they just send them to the next available doctor for any excuse possible. Sometimes they are referred to a physiotherapist, sometimes to the pain management clinic, other times for acupuncture, and other times for other measures. Patients sometimes can find it frustrating when they are referred to a psychiatrist or a psychologist to manage comorbidities such as depression, anxiety, and sometimes for sessions of cognitive behavioral therapy as a measure to address the fibromyalgia itself. If all of these don't lead to significant improvement in the patient, all too often patients feel like they are only being referred around, and this is particularly frustrating for them. Another factor on the patient side is the frustration from ineffectiveness of the tons of previous medications that have been tried. And each time they seem to have been given high hopes, only for them to be disappointed again when things don't necessarily change. This is a very frequent occurrence because every single time another measure is preferred, the physician looks forward to it with the hope that it will help. It is a common saying that I will try anything by the patient. This is because they are at their wit's end and they have exhausted all their effort on so many things they have tried, and they are always keen to do more. And each time they embark on something else, they're looking at it with the hope that this is going to make a lot of difference. And too many times this doesn't happen, and this can lead to frustration. It could eventually get to the point where the patient actually, out of frustration, falls out with the doctor. And this is another potential risk for this happening. A fourth one is the perception that doctors are being judgmental. And indeed, for so many reasons, it can come across to the patient that doctor is judging them. For instance, a patient is talking about widespread pain, difficulty with coping with activities of daily living, mental fog, poor sleep, memory disturbance, persistent migraine, and the doctor at the end of the discussion offers recommendations such as try to exercise more. The patient, who sometimes is probably overweight, wonders if the patient is judging their weight and is saying they are just being lazy. Sometimes when doctors actually say it will be beneficial to lose some weight, patient essentially interprets this as saying the doctor is calling me fat. And at other times, because it seems to appear on the face of the doctor as if they are impatient. And we must sometimes understand that the structure of the health service can be a bit complex depending on which country it is happening. And the allocated time for consultations like this might not necessarily be ideal for a case of fibromyalgia. And so, yes, the perception might be correct that it seems like the doctor has been impatient with patients. And this is another risk factor for falling out with them. At other times, it may actually come across to the patient as if the doctor just looks at them like somebody who is just complaining and whining and is not dealing and taking responsibility for their own lives. Well, this is another risk for disagreement to come up between the patient and the doctor, and this generally will not be of benefit to either party. Now, let's talk about the doctor factors that could lead to the falling out of doctor-patient relationship before we talk about things that can be done to prevent this from happening. Number one, on the part of the doctor, physician could become helpless. Fibromyalgia can be a very difficult condition to manage. And even among rheumatologists, it is not everybody that is necessarily a keen caregiver for fibromyalgia patients. And as a matter of fact, the care of fibromyalgia is so complex that at times it can be difficult to achieve measurable progress after several visits. And at some time, the doctor may feel as helpless as the patient feels. This can be a very difficult scenario for the patient, who may eventually have their relationship with their doctor broken down. Another factor on the part of the doctor is that the poor healthcare structure might not favor fibromyalgia. Now, fibromyalgia is a condition that, unlike what its name suggests, it is not necessarily fibro, which refers to connective tissue, because nothing is wrong with the connective tissues. And mya refers to muscle. Nothing is exactly wrong in fibromyalgia. The algia part of it is correct, which refers to pain. But the origin of the problem is actually in the central nervous system, where there's exaggerated perception of pain. Now, the problem here is this. In most countries, the care of fibromyalgia is oftentimes under the rheumatologist. And at other centers, it is partly managed by rheumatologists and pain specialists, and in other places, mainly by pain specialists. If the structure of the healthcare does not properly assign the management and the follow-up of fibromyalgia under trained specialists that could be helpful in the long term for these patients, there's a chance that it will be difficult to get authoritative answers to so many questions that patients can have, and this can be difficult for both parties. And this is the case in many countries. In the UK, for instance, rheumatologists are able to diagnose fibromyalgia, but they do not follow up cases of fibromyalgia, who are then referred back to their GP, who may also be referred to pain clinics, may be put onto various programs, including physiotherapy and pain societies and so on and so forth. When the healthcare structure does not provide the best avenue for these patients to be looked after, it can be a very difficult factor even for the doctor to deal with. Number three, time constraint and the role of CBT. In centers where follow-up appointments are just over 15 minutes, it can be very difficult to address all the issues that the patient could have accumulated since their last appointment. And all too often, we all know how difficult it can be for the patients to deal with everyday issues of fatigue, which can be profound and debilitating, and so many other non-pain manifestations of fibromyalgia. And now, when they come with a very long list of issues to address, and the doctor is constrained by the time, this can be a real difficulty between the two parties. And lastly, physicians can also be frustrated. And we have mentioned so many factors that can lead to difficulty in making progress in the care of these patients. And on the part of the physician who has tried many things and has not made much progress, so many things can contribute to them feeling frustrated. One is the stress factor of the job. I've had physicians talk about fibromyalgia patients that when they enter the consulting room through the front door, the doctor feels like exiting through the back door. Physicians are more likely to receive complaints from patients with fibromyalgia than other patients without fibromyalgia among their patients, provided we are referring to rheumatology clinic, for instance. Frequent attendance with little progress can also be frustrating for the doctor. All of these factors can come together to lead to progressive breakdown in relationship of patient-doctor communication and the progress that could be achieved in the care of the patient. So what can the patient do, and as well, what can the family do to help the situation and prevent the fallout? On the part of the patient, I will start by saying, number one, prepare for your appointment. Ahead of going, prepare a concise list of things you want to discuss with your doctor. Avoid making 50 pages of various day-to-day complaints that have happened since the last 6 months. This can be very difficult to get through. It can also lead to the possibility that the most important concerns to you will be lost in the pile of so many things that could not be run through during the probably 15 minutes of consultation, depending on where it is happening. And even if you have 1 hour of such consultation, it can still be difficult, because if you have so many printed pages for the doctor to read in the middle of that consultation, it might be difficult to expect them to get through it and for them to address all of our concerns. So this can make it complex, and the things that matter to us the most might not be achieved during the consultation. Number two, be aware that no one single intervention will dramatically change the situation. Now, I must emphasize here that it is important to know that a lot can also be achieved, but we should not put all hope onto one new intervention that has been discussed with us and think this should make it all brand new, because it will not happen. That will be like setting one step up for another disappointment. Now, usually, all patients with fibromyalgia will need combinations of either treatments or various interventions, and no single intervention will on its own take the pain away, say from 100 to 0, or make the fatigue magically disappear. Fatigue is actually particularly stubborn in fibromyalgia. And after long enough, if a treatment is not working, it may be worth discontinuing that treatment instead of piling up too many non-effective medications over and over. Now, this will just lead to useless polypharmacy that can only increase the risk of side effects without necessarily conferring additional benefits. Number three, commit to making good effort and let it show to your doctor. It can be helpful for the patient who attends the appointment with a positive attitude and looking forward to what role the doctor wants them to play. And this can actually urge the doctor who is getting to the end of their teters and probably already looking frustrated to see the new light and again be more committed to engaging with the patient and seeing what else they can try together. If we approach our next appointment with despondence, it can make things a lot more difficult and can make it even more challenging. So by committing to willing to make good efforts to achieving the next phase of progress, hopefully this could help the doctor and show the doctor that, well, we as a patient have not given up yet. Number four, it is important to pace our activities. Most patients with fibromyalgia are familiar with the concept of unexplained energy boost sometimes, and then flat out no energy for so many times. When we get some amount of extra unexpected energy, it is important for the patient not to overdo things and get burnt out all over again. Now, pacing the activities will be a helpful thing, because a patient might be attending the appointment today, they are feeling relatively good, and most rheumatologists are familiar with this. Hearing the patient say, today is actually a good day, yesterday was horrendous. So patients should try to pace their activities, and hopefully it will help them get a clear head when they attend their next appointments. This is no guarantee, but it is one of the things that can potentially be of benefit. And they should look into non-drug interventions. Now, it is vital to emphasize that not only will multiple things be required in the care of fibromyalgia, it's also important to note that all of the things that will be done don't necessarily have to be medications. The combination of non-pharmacological interventions such as Tai Chi, yoga, mindfulness, Pilates, with relevant medications could be quite helpful for the patient. And approaching the consultation with the willingness to engage in anyone that can be tolerated among these measures could actually be of benefit. And patients should not hesitate to run these methods past their doctor and hear their view about them. Discuss the things, this is number 6 now. Discuss the things you got told by other fibro patients who are receiving treatments that are different from what you are receiving with your own doctor. All too often, patients attend various forms of support groups, sometimes online, and they pick up other ideas from other patients with fibromyalgia. It can be helpful if they bring some of this back to their doctor and hear their view about it. Sometimes it might be something that is not supported by evidence, and sometimes it might be something that was particularly given to the other person because of other conditions they have and not necessarily because of fibromyalgia. For instance, opioid medications have not been known to help fibromyalgia a lot. But when a patient has something else underlying their fibromyalgia that benefits from opioid, that might be the reason they were given their morphine. So, let's now talk about what the family and friends of patients with fibromyalgia can do to help them. Number 1, it will be important to curtail high expressed emotions. Sometimes in an attempt to be supportive of the patient, family members and caregivers express their concern so much that it can become additional burden on the patient. Overly expressed emotion, concern, their observations about the patient can get on the nerves of the patient who are already struggling with sensory overload. And it is important to limit how much of emotions we express about the patient and regarding everything concerning them, because sometimes the impact of this can be counterproductive and not offer any benefit to the patient. Number 2, it will be important to help them remember things they want to discuss with their doctor and not to be diagnosing them with their own opinion about what is happening to them. Now, because of brain fog in fibromyalgia, a patient might forget many things they intended to discuss with their doctor during their next appointment. The family and friends can help by helping them organize their thoughts, reminding them to note some of this down in their own journal, and organizing things ahead of the appointment. And during the appointment, if the family or friend is attending with the patient, they should not take over the consultation. They should try to help patients remember things where they seem to be forgetting, and hopefully this can help a long way. Number 3, it can be beneficial if the family and friend help them to prepare for their doctor's appointment. A patient who is exhausted and fatigued today and who has an appointment tomorrow might not be all too inclined to do some preparation today ahead of tomorrow's appointment. It could be of benefit if there's anything family can do in gathering the journals that have been laid aside, maybe even read to them what they have written down and outline which ones they want to emphasize the most, so that the most important factors will not be lost in a sea of so many words. Number 4, do not call the patient lazy because they are fatigued. Fatigue is an extremely common component of fibromyalgia. And if the patient is already frustrated from home because the people they live with have predominantly negative opinion about them and how they are dealing with their fibromyalgia, this can have negative impact on the patient, and the mental toll of this can manifest during the consultation with the doctor, especially if the same family and friends are present during the consultation. We should remember that the disease is generally invisible, but it is potentially disabling for many people. Number 5, recognize that fibromyalgia is a long-term illness and a lot of patients will help. Patients with fibromyalgia need to be supported. They need to understand that people around them are not judging them. And if our attitude projects this to patients, including when they're attending their appointments and they feel supported, this could be very helpful for them to not get exasperated by the delay in achieving progress during the course of the consultation. And number 6, which is the last but not the least, it can be very helpful if the family, friends, or loved ones accompany patients to their appointments, provided that is what the patient wants. These are the kind of things we can discuss with our patients at home if we are their loved ones, and we can come to an agreement about what role they want us to play during the consultation, and we can help them gather relevant things they need to take along with them during their consultation. In situations where they have so many drugs and there is no clarity about which is which and which one they need to be taken and which one they need to stop, we can help them collect their medications ahead of their appointments and take it together with them, and hopefully this can be sorted out during their appointments. And fibromyalgia is a long journey, and patients and their family need to understand that a lot of patience is required, and being supportive of each other can be very helpful. It is very easy to say to a patient to be bold, to take responsibility for their challenges, but they certainly need a lot of help and support in achieving this. And hopefully this can help, utilizing these measures can help limit the risk at which there will be a fallout between the patient and their own physicians. If you found today's discussion beneficial, please do not hesitate to hit the like button and subscribe to my channel. And if you just click on the notification bell as well, you will get notified each time I upload another video, and you get regular updates of these types of videos going forward. Thank you for your time.